welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about the current scenario of COVID 19 in India. As we all know, the COVID 19 cases are increasing, and yes, we are diving into the third wave in India. Despite India crossing yet another milestone of 150 crore mark of vaccinations, the cases are on the rise, although the positivity rate is definitely decreasing. The spread is now moving towards medical professionals, children, and how severe are the cases. The debate on the fact whether these cases are of Omicron or is it the continuation of the Delta, how bad is the new variant of COVID owing to the increase in the number of deaths? The most important question of the lot is the management protocol that should be followed to treat the current situation. To answer all our questions, we have with us today Dr. C Khilnani, Chairman at the PSRI Institute of Pulmonary, Critical Care and Sleep Medicine. Formerly, sir was the professor and the head of Department of Pulmonary Medicine at AIIMS, New Delhi. We are happy to have you on board with us today, sir. So,
My pleasure.
considering the current scenario of COVID 19 that we are diving into the third wave, what is your take or what is your stand on the current situation that India is facing nowadays?
Dr. Nandita, we are not diving, we are in the third wave. Third wave is there, the community transmission is there. There are a large number of patients that we are seeing. The numbers are rising, but be assured that numbers that we are actually getting in terms of counts is only minuscule of what actual number is there. This is because very few people are getting tested, considering that everybody knows that it's a milder illness. Lots of people are doing home tests and becoming positive, and we know that once the test is positive, we are not even advising RT-PCR tests, and these are not being recorded. So therefore, the numbers are rising, and I suspect that this number will keep rising. The reason is that COVID, this particular wave of COVID, what is called Omicron, came from South Africa. So it came into the cities where the international flights are coming, namely Mumbai, Delhi, or you can say in South Chennai, in Kerala, Trivandrum, Cochin, and so on and so forth. We know that it is 3 times more contagious than Delta. Delta was 3 times more contagious than Alpha. So it is highly contagious. So it will percolate into the other cities and districts and villages over a period of time. So therefore, the numbers are going to be there. Some will be known, some will not be known. And given the numbers, it's a serious issue because if you look at the South Africa, where it started, and South Africa also has a distinction of having lower rate of vaccination, and also they have HIV population. So there, even in this wave, as per the publication, there were 31% people who came to emergency were in respiratory failure, 2.7% died, 17% were requiring oxygen. So this wave should not be taken as innocuous or which is not serious. So therefore, although it is a mild illness, but it has a potential to cause serious illness in some susceptible populations. So we have to be careful so that our healthcare system is not overwhelmed, considering the fact that the whole lot of medical health personnel are getting infected and going off work for a period of time.
So, very truly said, sir. Definitely, considering the population that is getting affected more and more, the variant is affecting the medical professionals, children, and even elderly with comorbidities. So, if we talk about their risk potential, so out of these categories, who would you say are at a higher risk of getting the disease?
So, as we have learned during the COVID times, the people who are more than 60 years of age, people who are obese, people who have hypertension, diabetes, coronary heart disease, people who have chronic kidney disease or liver disease. Besides that, people who are transplant patients or people who are who have on chemotherapy or being treated with immunosuppressive drugs for collagen vascular diseases like rheumatoid arthritis or SLE or polymyositis. The list is too long. But my thinking is that we have to discriminate. When we say elderly, you have to discriminate between a person who is 60 years as compared to 80 years or 85 years. So there, India has a large proportion of people who are immunocompromised because of the age and because of comorbidities. And India being a capital for diabetes, it becomes all the more important. So the Omicron wave is maybe milder, but given the numbers which are getting infected, even the smallest proportion will make a large number, as it is seen in certain cities like Mumbai. Some of the ICUs are full at this time. In Delhi, also, hospitals are getting uh, filled up with COVID patients, not to the extent that we saw in April. Here also, we have to understand and discriminate between the people who are in the hospital because of COVID and because those are with COVID. That means that some people have got actually serious disease and they are incidentally found to be COVID positive. So that needs to be discriminated. Summarizing it, we need to take care of these people who are highly susceptible because of their age or underlying diseases.
So very true, sir. We really need to categorize those people, and we need to concentrate on a population who is at high risk of getting COVID. In fact, now if we talk about considering only this particular wave as we're diving into it, so what is the nature of this particular wave? Whether it is confined only to the Omicron variant, or is it the Delta variant only which is carrying, or is it a mixed wave of both?
So, with a good speed, this wave is predominantly of Omicron as the data is coming, and it actually replacing Delta wave and Delta variant. But it's not the Delta variant is gone. And although we don't have immediate sequencing of our patient, but there are patients who have got respiratory failure, those who are on ventilator. There are deaths being reported, as you all know. I think part of these cases are having infection with the Delta waves as seen in the other countries like United States. As the data suggests from developed countries that with the gradually the Omicron is replacing Delta, but Delta is still there, which is a more lethal lethal disease. So therefore, our management strategies will also be changing depending upon the proportion of Omicron which is there in the community.
Very true, sir. Very true. We definitely need to be prepared for the worst as well as deal with the situation as it comes. So, there have been a lot of guidelines which have been raised or which have been revealed for the general management of an epidemic or any confined to a specifically laid out for a particular patient. Being a clinician, what will be the management protocol if we have to follow, if there is any protocol management therapy that we can follow for the management of such the Delta Omicron variant in India?
So uh, there are two issues that we need to consider. In COVID, we have learned the management of acute care that consisted of remdesivir, that consisted of corticosteroid, anticoagulation, ways of giving oxygen, high flow nasal cannula, BiPAP and ventilator and ECMO and so on and so forth. But now the focus is different. The large proportion are having mild illness and a very small proportion require hospitalization. Therefore, the strategies have to change. Now, I'll give you an example. If the person is 35 years old who is not obese, he has no comorbidities, and he is presented with fever, with stuffy nose, and little bit of cough, and he is found to be COVID positive,
Mhm.
I do not give him any active treatment in the form of antiviral therapy or even antibiotics. The previous medications like hydroxychloroquine, ivermectin, azithromycin, doxycycline, favipiravir have no role in such patients. So these patients should be isolated in the interest of preventing the transmission and just followed up with symptomatic treatment with paracetamol or antihistaminics or cough syrup, steam inhalation, and so on and so forth. However, here I would also like to say my experience about seeing patients, which I am seeing a lot, that patients with Omicron during this time, usually they present with very mild fever and running nose or stuffy nose, scratchy throat, feeling chilly, but the fever is not very high, it's a bit of headache. Some people are even having backache as their symptom. I am not seeing complete loss of smell and taste during this time, which exemplifies that neurological involvement is not there. And as we all know that Omicron usually doesn't involve lungs, so pneumonia is also not common. So continuing with the question that you asked me, that if the person has comorbidities that I already described, then I have to be a little more careful. What I do is that there are three choices that we have.
Mhm.
One is the what is called as cocktail antibodies, that is the monoclonal antibody, casirivimab and imdevimab combination, which is available with us. Other monoclonal antibodies which are effective are not yet available, so I am not talking about it. There are two antiviral drugs which have got a proven efficacy, which is available with us. That is molnupiravir and remdesivir, and third is Paxlovid, which is not yet available with us. Now, I'll tell you how to choose between these. So far, so till now, we do not have facilities of diagnosing whether this RT-PCR is Omicron or not Omicron. Although
True.
there can be claims of PCR test where S gene deletion can be diagnosed, which makes us be sure that it is Omicron, but that is not available with us till now. So we'll talk about management without knowing whether it's Omicron or not Omicron. So in this susceptible population, uh, if the person should be given a choice of monoclonal antibodies depending upon his comorbidities. I'll give you an example. If there's somebody is 85 years old, diabetic, which is uncontrolled and has got heart disease and has got a pretty bad general condition, I
Mhm.
would give him a choice of monoclonal antibodies because who knows that he may be having a delta infection. I can't diagnose that.
Very true.
Otherwise, the better choice is antiviral drugs, that is molnupiravir and remdesivir. Molnupiravir can be given orally in a capsule form. It is given 800 milligram twice a day for a period of 5 days. It is remarkably safe drug with the rider that it should not be given to pregnant ladies or lady who has a potential to become pregnant, or she should be advised to practice contraception for a period of 3 months because it has some mutagenic effect. It is not yet recommended for lactating women also, and also not recommended for uh, patients below 18 years of age because it has a potential to affect cartilage development. If you understand these riders, molnupiravir is safe medicine to be given for a period of 5 days. It it the reduction in disease becoming severe is to the tune of 30%. That study was published in New England Journal of Medicine, and the chances of death were 9 against 1. So that was significant reduction in the mortality also. Therefore, I consider it as a safe drug, although the guidelines have not placed it in that position. The other drug is remdesivir. We all know it is a time-honored antiviral drug for COVID. The latest study, which was published on 16th of December in the same journal,
Mhm.
showed a 87% reduction in severity when remdesivir was given for a period of 3 days, 200 milligram on first day and 100 milligram on subsequent days. With the rider that it should be given within 5 days of onset of symptoms to a population which is more susceptible. Now, remdesivir is to be given in the hospital. Patient needs to be admitted for a few hours and it should not be given on the OPD basis, because if the patient comes every day, he has a potential of transmitting COVID infection. So therefore, efficacy-wise, remdesivir is more effective in reducing the severity. Safety-wise and ease-wise, molnupiravir is more effective in giving it to all patients. Now, this should be given subsequently. Any patient who's beyond 5 days, if he is running high fever, whether he is young or old, susceptible or non-susceptible, we should consider a severe disease and start investigating him with blood investigation like CBC, CRP, D-dimer, ferritin, and IL-6. Or if there is a desaturation on oxygen monitoring, then these should be subjected to CT scan and treated as a moderate or severe disease. So the more and more focus is on early diagnosis and early treatment with antiviral drugs or monoclonal antibodies, so that no patient should go into severe disease and die. So that's the focus, and I hope that soon we'll have sotrovimab, which is an antibody, which is monoclonal antibody, which is effective against omicron also. If that is available, that will be the monoclonal antibody of choice. Thank you.
Thank you so much, sir. That was really a very informative, detailed, I would say, description of the management protocol. Yes,
So
sir.
I want to say something more about the future.
Sure, sir.
So with the India, 90%, more than 90% of adults have received at least one vaccination. Almost 50% are completely, 50% of total population is completely vaccinated. And it is proven by scientific study that Omicron infection gives a mild illness but gives a robust immunity against COVID. If we combine the vaccination and the infection that we are seeing, I think we are heading for a state over a period of maybe a month or two, where the large proportion of Indian population would be immune because of infection as well as the vaccination. And remember, the vaccination followed by infection gives the best immunity and long lasting immunity with very high titers of antibodies. So I hope that in 2 months' time, this disease would become endemic, and then we'll have a normal quality life, quality of life. Thank you.
Definitely, sir. So that is a good insight that if we spread this across, definitely we will empower more people to get vaccinated in the first place, and thereby getting the severity of the condition will definitely reduce in such situations. So it was a very good, informative session, sir. If I talk about the management aspect, it was a very good, detailed information, and that I'm pretty sure is going to help a lot of practitioners to lay down a particular standard of therapy or the protocol, if I could say, just to carry out if a patient walks into an OPD, so you will be able to assess the symptoms, the diagnosis will help, and also the management protocol. So that was really a good session
Thank
with
you.
you, sir. And I'm pretty sure a lot
Thank
of
you.
practitioners will benefit out of this session.
Thank you.
Thank you so much, sir. Have a great day.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.